Hey guys, it's me, your trusted doctor, Dr. Masood, and I want to teach you something today to kind of make yourself feel good within 3 days. And what we're going to talk about today is what's called the antigen overload theory. And that basically means is that if you're suffering with an autoimmune condition, whether it be Crohn's disease, whether it be things such as like rheumatoid arthritis or multiple sclerosis, any autoimmune disease. Now, what is an autoimmune disease, you might be asking, if you don't know? What autoimmunity simply means is your body actually attacking itself and thinking that something that's normal is actually foreign to the body. And so typically what happens, the way it should work, is that if you, let's suppose, got a bacteria that your body didn't like, or a virus that your body didn't like. So this bacteria or virus comes into the body. Your body is so smart, what it will do is it will release antibodies that will come in there and they'll kill and destroy the antigen in the body, and life's good, you're feeling great. But what happens is over time, is in some cases, as the antigen comes in, there's so much of this antigen that eventually the body is sending these antibodies to kill it, but the body actually starts getting confused, and once it starts getting confused, it starts attacking good tissue, bad tissue, and it's not always attacking the bad substances that are inside your body. So that's why I said the antigen overload theory. And what the theory basically means is that if there is too much of bad stuff in your body, eventually your body can lead to these autoimmune conditions. And so now that is the theory, but let me tell you something on some things that actually work well for people that are suffering with these type of conditions. Number one is it's always a good idea to find out what's causing inflammation inside your body. Now, here's the thing. I'm going to give you some common things that cause inflammation, that can cause your body to start attacking itself at a higher level than it should be doing. One of the things that we typically know without even doing any testing, what we do at the clinic, but without doing any testing, these are some common triggers for people. One could be sugar. So anything that turns into sugar in the body, that's going to elevate inflammation. The other thing is something called gluten. Gluten basically is going to be in things in your wheat products, and rye and barley and so forth. That protein molecule in general, people don't do very well with that. So if you get rid of the sugar and you get rid of the gluten, for the most part, within 3 days, people are going to actually feel better. They're going to have less inflammation inside your body. The other thing is from a physiological perspective, is something called stress. Now, stress can come from the sugar, it can come from the gluten, and other foods that you may be eating and foods that you might be toxic to that can cause inflammation in your body. But stress can also come from psychological factors. So things that might be bothering you. You might be at work, you might be getting stressed out. There may be somebody at work that you don't like and you're thinking about them, your mind's hyperactive all the time. That hormone, that cortisol stress response, as that gets elevated, that causes inflammation inside your body. Now, once that does that, guess what happens? Inside your gut, what that does is starts eroding the lining inside your tissue in the intestinal area. Now, what then begins to start happening is those cells that were once tight, those junctions now begin to open up. And so as they open up, guess what? Molecules that were getting out and being destroyed and released from the detox system, now they spill into the bloodstream, and so that can further cause an aggravation in autoimmunity. So just elevating the stress alone could affect your gut lining, that could cause you to start having some issues with your autoimmunity or causing flare-ups for you. So decrease your stress level. So how do you decrease your stress level? Is simply like one of the techniques that I taught you was the breathing exercises. So if you didn't watch that video on those breathing exercises that we discussed. The other thing is exercise. Everybody knows how important it is to exercise. We hear these videos, but sometimes we don't do anything. Well, guys, guess what? You want to feel better? You got to go do something. And so now here's what you want to do. Don't make it a chore. Enjoy your exercise. So it could be something as simple as just taking a walk that day if you're not used to walking. If you are walking, then walk a little bit faster. But enjoy the exercise. Don't make it be something where you're exhausted, where you're fatigued, and you're causing more tissue damage to yourself. Do something that you can tolerate, that you feel a little good with, and then when you feel good, walk away from that exercise. I don't care if it was 5 minutes, 10 minutes, or 15 minutes, or 20 minutes. Walk away when you're feeling good. And then wait for 2 or 3 days to see how your body responded to that exercise so that you can find out the level and the intensity of exercise that your body can handle where you feel good. Now, if you try those little changes, getting rid of the sugar, getting rid of the gluten, and then you go ahead and do those deep breathing exercises, and then you control, your stress level, and then you increase your exercise level, guys, you're going to be feeling better in about 3 other days. You can take that extra energy, then you can find a doctor, a functional medicine doctor like myself, and if you want to go further and beyond, go get yourself tested. There are amazing tests out there that will tell you what foods you should eat, what foods you shouldn't eat, how you should exercise, how you shouldn't exercise, and overall a coach that can actually guide you into continually improving and getting better and better health for yourself. All the information, all the resources are out there, guys. Sometimes we just need coaching and we need some tools to get ourselves to the next level. This has been your trusted doctor, Dr. Masood. Take care, guys. Have a great day.